Hi there, my name is Dr. Dennis Wolf and I'm going to talk to you today about VASER Aftercare. Immediately after the procedure you'll be going home very padded in a compression garment, and this is really just to make sure that you arrive home dry and that over the first 24 hours you'll not have leakage into your clothes. If you do have any breakthrough leakage, it's important just to put some more padding in. I would leave the compression garment in place. It's important not to remove this for the first 24 hours. The following day, you should have a shower. To do this, it's important to lie down on the bed or on the floor. Remember that when you open the garment, your blood pressure will drop and you might get a head rush and feel slightly dizzy. To prevent yourself from injuring yourself, it's important to either lie on the bed or do this on the floor. As soon as you've opened the garment, lie there for a few minutes and let your blood pressure normalize. You can then take all the padding in the garment off and get yourself into the shower. Have a gentle shower, and once you've completed this, pat everything dry, come back out, and now it's time to put the compression garment back on. This can either be done lying on the floor or on the bed again, and the amount of padding you'll require will be significantly less. The leakage you can expect is going to be pink coloured fluid, and this will be a certain amount of local anaesthetic, a certain amount of fat that has not been extricated, and a small amount of blood which gives it the pink tinge. This will change colour from pink to yellow and then eventually colourless. Over the following days the leakage will develop to just a small amount of spotting, and hence only small amounts of padding will be required. The aftercare will also include you having arranged MLD sessions, which are important in the aftercare of both VASER and fat transfer. Remember that there aren't real limitations as to how many sessions you can have, and I certainly recommend as many as you can afford. After the procedure you'll be given a course of antibiotics and also some pain relief. The antibiotics are really required just as a preventative measure to prevent any form of infection. Remain cognizant of flu types of symptoms, and if you have any concerns it's important just to call me directly or the clinic and voice your concerns. We can then arrange a follow-up appointment on the same day to come and see me so that I can assess if there is any need for concern. Pain relief will also be supplied. Generally, patients will require pain relief for the first 48 to 72 hours. Occasionally, I've had patients that have not required any pain relief. This shows you the gentleness of the procedure and also the difference from traditional liposuction. All my follow-up appointments are pre-arranged. I generally like to see my patients at least 3 times. And certainly if there is any concern, I'll see you as many times as is required. It's important to remember that if you do not come in and see me, I cannot guide you on how your recovery period is progressing. And thus, if there are any changes or any complications that I've not been made aware of, I cannot deal with these. So it's important to remain vigilant, cognizant. All patients get my mobile number after the procedure, so they can get hold of me after hours or on weekends if the need arises. But obviously I'm also available through the clinic.